Well, we're here with Dr. Planty from Baytown, Texas, a optometrist whom Dr. Planty is fixing eyes for people for quite a while now. Hi, Dr. Planty.
Good afternoon, Helmut.
Good afternoon. Dr. Planty, tell me, in your practice in Baytown, which is what, east of Houston? Is that where you are?
That is correct, 30 miles east of Houston.
Got it. So, in your practice, give us a little bit of a good overview what people can expect when they come in, and what do you do for them? Is there something which is your specialty? Is there something where you stick out versus another optometrist office, or things like that?
Well, I've had a long history of working with kids in sports vision and fitting contact lenses. More importantly, difficult contact lenses like toric contact lenses for astigmatism and bifocal contact lenses for patients that are presbyopic. So the harder the fit, the better the job I do.
Okay. Explain, and maybe only to me and not to the other 9,900 million listeners of this video. There's two words you said, astigmatism, and the other one I already can't pronounce anymore. So explain that to us in what the heck that is, please.
Well, astigmatism is an irregular shape of the front surface of the cornea. Instead of using a spherical contact lens to fit that patient, we have to use a toric contact lens. And a toric contact lens is a contact that has two prescriptions on the front surface, one going up and down and one going across, that helps neutralize the patient's astigmatism, hopefully down to zero, to where they're able to focus entirely on whatever it is they're looking at.
So the other one is... So tell me what astigmatism, how does a patient who's walking around there in the fog, I guess, I don't know, anyways, walking around there, what is the symptom he has when he has astigmatism in his eyes?
Well, the vision's going to be distorted, and it's going to be distorted, elongated, either up and down or across, depending upon which direction their astigmatism goes in. Astigmatism can be up and down at axis 90, or it can be going across the horizontal at 180. So
is it like the mirrors, when you go into those things where you have
there you go.
So you see yourself long or fat or something like that?
Absolutely. Exactly. That's what the patient sees, and it's not going to be clear. It's going to be very fuzzy.
Imagine that poor chap who looks at a girl which is fat, and yet she's so gorgeous, like it's unbelievable, and he thinks, oh my God, another fatty, I can't, but this is bad.
Watch out now. We help people to see better.
Good, all right, and so that's that one, so you're fixing that, and then what's the other word, the one I cannot pronounce already?
Presbyopia. Presbyopia means old age. That's where you have to start wearing the bifocal, and bifocal fits and contact lenses are a difficult fit, but those are the challenging patients that I like to deal with.
And the reason you need that is because on one hand you start getting nearsighted. You need those 99-cent glasses to be able to read. And on the other hand, what? You also have a problem seeing far or what?
Well, you don't have to have a problem seeing far. You can, but you don't have to. Like in my particular case, my distance vision is absolutely positively perfect, but I have presbyopia. I can't see up close, so I have to wear readers or bifocal glasses or bifocal contact lenses, which will allow me to see both down the road and up close at the same time.
Got it. Since we're on that topic of, people who lose their vision in terms of reading, and I very much fall into that category, is there also surgery for that? You keep hearing laser surgery, but nobody tells you what the hell you're getting it for on those ads, on those radio ads. Go and come in and do laser surgery, and for what? So tell me.
Most of the laser procedures that are out there are for patients that have a distance issue, can't see at distance. There are some other procedures other than LASIK that are available to take care of the reading, and that involves with putting implants in the cornea or implants inside the eye. But there's not really a true LASIK procedure for the presbyopic patient or the patient that needs reading glasses on top of their distance correction, or somebody that has perfect vision and needs a distance and needs help on the up close. So there's no laser for that, but there are other procedures that can be done.
Wonderful. All right. So I got the two ones now, the old one and the astigmatism. So what does that have to do with sports eyes? I mean, you mentioned that at the beginning. What does those two have to do with this children and sports?
I think a long time ago, a guy by the name of Muhammad Ali said it very best: float like a butterfly, sting like a bee. You can't hit what you can't see. So essentially, if you can't see, you're not going to perform well in athletics. I coach a lot of baseball, so the hand-eye coordination of a 90-mile-an-hour fastball, you need to see that and need to see it clearly, and you need to see it quick. Whether it's regular contact lenses, spherical contact lenses for nearsighted or farsighted, or whether it's contact lenses for astigmatism, you need help to see what you're trying to hit.
Well, Dr. Planty, that was a wonderful explanation. Muhammad Ali, whom I'm old enough to still know him under Cassius Clay. And I actually was watching at 4:30 in the morning, going to the train for my engineering work I did at the time, and watching in a shop which sold television, and they have that displayed, and there was like hundreds of us standing around, all coming from the train going to work in a big factory like a la Detroit, and there we unfortunately watched him going down.
It happens.
The thrill of Manila. All right, we'll talk to you more, Dr. Planty. Bye-bye.
Bye-bye now.